There's no access for doctors, there's no access for medications. That trying to have a consultation for them means walk 2-3 hours all the way down to a health center to find it close, or hear from a doctor that there is no medicines and that they have to buy it.
Solo tenemos el centro de salud con una enfermera, pero no tenemos médico y tampoco medicamentos.
Me queda muy largo el hospital y aquí, bueno, ya hoy que vinieron, está más cerca de mi casa y para transportarme hasta Choluteca es muy largo.
Las enfermedades más comunes, al igual que el resto del país, pues tenemos lo que son las infecciones del tracto respiratorio, las diarreas, las infecciones de la piel, tenemos las enfermedades crónicas, tales como la hipertensión, la diabetes.
Diseases that we treat during Brigades are respiratory disease, skin problems, and in the last years we have an increase in high blood pressure and diabetes too.
La coordinación con Globals nos ayuda mucho a beneficiar a la gente.
The medical brigade works like a mobile clinic. We have the first station that is intake, that is managed and handled by people and volunteers of the communities. After the patient receives her patient form and gives all her personal information, it moves down to the next station in the brigade, that is triage. Triage is handled by the students, by the volunteers. You take all the signs of vitals, weight, height, temperature, blood pressure, and you ask the patient what is the main issue of complaint, what he or she in the brigade.
They talk to us about symptoms they have and problems they've been having, things like fever or blood pressure or stomach pain.
She or he sit down in front of the doctors and explain to the doctors her illness or her pain. They are seen by the doctor, they are checked out by the doctor, and the doctor prescribes the medication that they need.
And honestly, they didn't even seem tired. It was amazing. And so I asked, how do you do this? Like, how do you continue to work, throughout the entire day? And he said, because it's not just because, we're treating them and it's just, my job. It's honestly, it's something I love to do, love helping others and saving lives. Without these doctors, this couldn't happen.
Once they leave the consultation room, if it's a woman and if she needs or she asks for it, she moves to the pap smear station. We are helping a lot of women that they don't have access to have this test because of economic situation, because they have to move all the way down to the city for seeing a doctor. And 2 or 3 weeks later, they receive the results of that pap smear for free, and if they need any treatment, they also receive that treatment for free. The other station, that is dental station.
I'm a dentist and I've been working with Global Brigades more than 2 years. This is what we do in medical brigades. Dentistry, pure dentistry, diagnosis and treatments of our patients every day. When we work in medical brigades, 90% of our patients are in pain. We basically do two different treatments, extractions and fillings.
We perform fillings, extractions, cleanings, fluorizations.
This is a very amazing opportunity because we can provide dental treatments and dental care to everyone. We had the opportunity to go to the school and get a degree, and now it's time to give back a little bit to the people who really need in our country.
After they have seen the doctors, they have seen the dentists, and they have the pap smears, patients move to the educational stations.
Not only do we treat the patients, but we teach them on how to improve their health.
Where volunteers of the community talk to them of several health topics, like how to purify water, how to keep the latrines clean, how to deal with high blood pressure problems, with diabetes. They learn about cervical cancer, about prostate exams and prostate cancer. So they receive this information, and The great part of this station is that it's performed by volunteers of the community. Volunteers that previously had been trained by our staff members, the preparation of the brigade, and we are empowering them. We're empowering the community, and we are involving them and getting them involved with our job.
Lo que nos ha dado el doctor Bruce, pues yo me siento pues capacitada para tomar una presión arterial, por ejemplo, para saber cuando una persona necesita ayuda porque está deshidratada por una diarrea o también por una neumonía, pulmonía. Eso lo he aprendido del Dr. Bruce.
While they are on this charla, the members or the team of pharmacy is working, preparing all the prescriptions that the doctors gave to these patients, so that when the charla ends, they receive all their medications for free.
The whole idea of Global Brigades is that it's not just one aspect. There are multiple aspects: microfinance, business, architecture, medical, of course. We could attain sustainability.
No voy a decir que todo es fácil, no voy a decir que todo es tranquilo, es difícil, pero creo que al final del día, cuando logras tus propósitos, sí te sientes satisfecho, sí te sientes bien,